Hello everyone. What if I told you that crime is not the only thing that Jamaicans living abroad think about? And even in Jamaica, that might not be the main concern too. Yes, it is healthcare. The reality is that healthcare, it cripples individuals from making that decision to come back home. Just think about Miss Pearl. She wants to come back home and she's like 40 other people she knows around her. And she's thinking about returning home, but she's in her 50s. Yes, she has a little sugar and she's managing two grown children at the same time, and they need insurance. Now, every night she looks at pictures of her homeland, the land that she loves dearly, Jamaica. But she's thinking about what her father left her. Father left her land. And she can't stop thinking about four words: the healthcare system USA. That is crippling her. Because let me tell you, I want to say that she's thinking about returning home, but she's asking herself the critical question: what will happen when I return home? But I want to reframe this a bit. Last month, a research company called Gallup, they did a research. 1 in 4 Americans working are staying in their jobs just because of healthcare. Yes, healthcare insurance. You actually have to pay for healthcare insurance in the United States. It can vary from 100 to 200, even going up to thousands of dollars a month. Now, that's 23 million people in the United States. Workers that are actually thinking about what if they get sick, so they can't leave their job. Sick people working jobs they hate. They're taking out coverage just to pay for healthcare. And Miss Pearl is not the only person in this situation. But I want you to think about her story, because her story is something that has crippled not only Jamaicans, but people across the diaspora and even in the United States. I've spoken to several individuals that were born here and they say to me, I can't retire because of health insurance. And if they retire, they're thinking about doing odd jobs. Just think about this. Nobody watching you at this point in time. You'll die without health care. Is that really it? Or you're just afraid of the bill? Yes, because that bill can wipe your house out. It can wipe your savings out. And that's the fear of many people. I don't want to say that you should not think about this fear, but I want you to think about what matters most. If you were able to have the best of both worlds, why not have a little insurance that you can afford back home in Jamaica and still be all right? Money fears rather than your health. That's a system. Debt fears can only be obeyed if you actually have the money to put up. Now, let us look at Jamaica's health system. It doesn't run on a health insurance. There are many things that I think need to be done regarding improving the healthcare system. And I've seen so many cases. As a matter of fact, my great-grandfather, he went to the hospital and didn't come back. My mom did the same, other relatives the same, and no elderly person that I distinctly remember in my family went to the hospital and came back in their 70s or 80s. They all died there. So it tells me that we kind of need a different sort of system, some system that will support individuals even if they have limited money. But in America, before you even get treatment, they want a card. Before you walk in, they want to know that you are all right to take care of the bill. But in Jamaica, it's different. You can walk in and then you'll be treated. There's no consideration about not getting that ambulance to come for you because you can't pay it. Just imagine this individual got hit down by a car in the United States and he's damaged, right? But he refuses to take the ambulance because he knows the cost in Jamaica. There are two layers of health care in Jamaica, of course. You have the private and you have the government funded. No, there are limitations there too. There are hundreds of stories going around and you can search for them. And I'm not going to go down there because I don't do the politics, but just look at what people say about the health system and know where you are in preparation for that. So most viewers might not know about this, but Jamaica has a national health fund. And this is genuinely a wonderful fund. I've heard people talk about it. They get medication and it covers certain treatment and so forth. And these are common illnesses. You know, these illnesses that high blood pressure, your diabetes, it will cover that. So that is a solid point for consideration if you are in Jamaica. But in the United States, the same thing would cost you a lot of money. Yes, I remember just taking my daughter once to the hospital in the United States. They didn't give her any medication, and all they did was to observe her for the night. And we paid out of pocket, yes, $1,000, but the bill was 10,000. For what? Some people say no one wants to insure me in Jamaica, or if I return home, how do I get coverage? But I want to say that there's some coverage that you can get, and I've done some research. I'm going to post this information. I'm not advertising this company, but I did some research and found out that this company offers insurance. You pay as you go through, and there are different layers of services that you can get. So you have the public and you have the private. But we have to understand that when we think about certain illnesses, you might say, do I get coverage for pre-existing conditions? Yes. After 6 months, you can get that covered in Jamaica based on the insurance that I had a review of. So when you look at the American system and you look at Jamaica and you say that you're not returning home because there's not a healthcare system that is effective in Jamaica, I'm not going to comment on the whole different perspectives because some people think it's a wonderful healthcare system, but I want you to critically evaluate the stories that people tell, the overcrowding aspect of it and so forth. Investigate that and know where you are as it relates to ensuring that you have coverage, because that's important. America has certain things, Medicaid and Medicare, but some people have to pay some money to ensure that they have full coverage, and that's the age of 65. If you're out of the country, there might be some limitations in that based on what I have researched. But if you're coming back to Jamaica and you see you need coverage, there are possibilities. You have your doctors there and you have private insurance that you can get. So when people think about healthcare, they have to ask themselves, what do I have to cover me in Jamaica? How do I get emergency care when I want? What happens if I get ill and I have no relative around me? Another thing you have to think about is the access to your money. Why do I say this? I'm trying to complete a transaction with a bank for the last 72 hours, and that has been impossible because they believe you have to do a Zoom call to get your token reset and to do this and do that. I had to record a conversation. I'm not going to share it. But in the essence of it, I asked a question. So what if I had an emergency situation regarding my health crisis? They just couldn't answer. I mean, they just couldn't answer. The person on the line said, we have already given you your number, your case number, so I'm sorry. As a matter of fact, I'll contact you when someone becomes available. And that is roughly 15 hours yesterday and another 10 hours spent waiting again. So you have to think about access. So wherever you live, think about the locality of getting that support. I've often said that I would not live anywhere that is too far from an airport or, let's say, a hospital. And people have shared that with me. So I don't want you to think that healthcare should cripple your decision to come back to Jamaica. But you can get the best of both worlds. You can have coverage in Jamaica. You can have coverage in the United States. That's what you do if you're living one place or the other. And I would say at this point in time, that is how you might want to think about your healthcare system. Sure. But I wanted to share this with you because I think it's important that you build the bridge before you need it. None of these items are beyond expensive in Jamaica if you have the money. So I would say have your records, do all the things that you have necessary. And if you line up your insurance in Jamaica, there is a pathway for that. I was telling some other people while prepping for this video that there are pathways that you can have access to insurance. And I'm going to put some listing and some information regarding the research that I found out. So I want to say that people in Jamaica are living to their 80s, their 70s, and even 90s and 100. So my question is, Many of them do not have health insurance, but they have lived. They have eat food that is good out of the ground. They have done their communication with others. They live a wonderful social life. So I would say happy life and good friends and good insurance and healthcare will take you a long way, because I think you should not let insurance be the only thing that keeps you away from a wonderful place that you could enjoy. So you can have insurance, but don't let the healthcare system cripple you in such a way that you cannot make that move, not only to Jamaica, but to elsewhere. Because what you're saying to yourself, there's one emergency case that I must plan for, therefore I need health insurance. And I think, for example, the National Health Fund in Jamaica offers so much and is expanding, and sometimes even the medication that you take in the United States might be just cheaper in other countries. So I want to say, think about that. I want you to understand that coming to Jamaica is something that has to be planned. And that's why I'm talking about the health insurance, because it's important. I've seen where individuals go into hospitals in Jamaica and they don't like the system based on it's public, it's overused to some extent. And I would say also that there might be some staff issues, and there are many other issues. And sometimes it is said that in Jamaica, to get good quality healthcare, you might need to know someone. And that's the reality of it too. As I stated before earlier, Jamaica is a who you know situation sometimes, and that's the reality. I can't tell you it's not so. And many people suffer because of that, and that's just not right. And healthcare should be free, and it is free. But sometimes when we look at it, we might say the quality needs to be improved. But don't let healthcare cripple you in such a way that you won't move from the United States. And that's all for now. Just a critical thought that I had to share.